Not only are these steroid injections not truly addressing the underlying problem, which I'm going to get into shortly, but they can also have serious side effects, right? The next level that we go to is typically corticosteroid injections and then injections of hyaluronic acid, right? The lubricating fluid that's normally present within joints. Steroids work by driving out inflammation. Inflammation is your body's attempt, the immune system actually trying to heal where there's a problem, right? And the inflammation, there's a reason that it's painful. It's telling you, it's a warning signal telling you there's something not right. So not only are these steroid injections not truly addressing the underlying problem, which I'm going to get into shortly, but they can also have serious side effects, right? Maybe associated with faster progression of the disease of osteoarthritis. And again, according to the research here, studies from the Osteoarthritis Initiative collected annual x-rays for 4 years from patients who got corticosteroid shots compared to those in the control group. These x-rays revealed worse arthritis progression in those injected with corticosteroids. Okay, so if you think about it, right, if it's your body's attempt at healing and we're driving out any form of inflammation, it's going to feel good, but it actually causes that matrix, that glycomatrix of the joint itself to break down. University of California, San Francisco looked at MRI scans from participants who got steroid shots compared to those who did not. The research looked at MRIs that were taken at the time of injection as well as 2 years before and after and found more severe cartilage deterioration by the 2-year follow-up among the steroid taking group. Side effects, right? Cartilage damage, osteopenia and osteoporosis, increased blood sugars, right? We see this all the time where it just absolutely throws off people's blood sugars. And then we have to work even harder to help to get the body back to normal again. Causes fluid retention, GI bleeding and ulcers, atherosclerosis or hardening of the arteries, mood changes, joint infections, nerve damage, increased blood pressure, trouble sleeping, weight gain, and eye problems. Probably not something that most people are told when they go in to get these different things. And oftentimes we'll have people have 10, 12, 15 of these over the course of years. These injections were never made for chronic long-term use, right? They were very much for short-term use, just trying to get to drive out that inflammation, maybe a one-time thing, so the body can go back to normal, but it doesn't usually work that way. The longer-term intra-articular corticosteroid injections offer only harm for knee osteoarthritis. So this is from the Journal of Osteoarthritis and Cartilage. Steroid injections may lead to more long-term harm than previously thought. And so as more and more research comes out, the more and more we recognize that maybe this isn't the best approach.